Hello, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Dave Chancellor, and I'll be your host today. We have a great webinar coming up in the next hour or so, as we'll be hearing from Manasi Deshpande about evidence on key questions in U.S. disability policy. Deshpande is an assistant professor of economics at the University of Chicago and also a faculty research affiliate with the NBER, National Bureau of Economic Research. The presentation she'll be giving today is actually an expanded version of a talk she gave at the annual Poverty Research and Policy Forum in Washington, D.C. that IRP hosted earlier this fall. And we're just really delighted that she's on the line to share this with us, all of us for part of a webinar today. So Manasi, thanks for being here.
Thank you, Dave.
I also want to acknowledge the Office of the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services for their support of this webinar series. That said, any views expressed in today's webinar don't necessarily reflect any positions of ASPE or the Institute for Research on Poverty. So as we get started, let me give you a quick outline of our webinar today. So we have an hour, and Professor Deshpande will talk for about 40 or 45 minutes, and after that, we'll save the final 15 minutes or so for your questions. You'll see there's a Q&A box at the bottom of your screen, so please feel free to type questions into that as we go throughout the webinar today, and we'll get to as many of those as we can before our time is up. So with that, Manasi, thanks so much for being here, and I'm going to turn it over to you now.
Thank you so much, Dave, and thanks everyone for tuning in. It's really a pleasure to be here today to present this work on key questions in U.S. disability policy. And I'm also looking forward to your questions at the end. So what I want to talk about today is the two large federal disability programs and important questions that we need to answer to be able to design these programs in the most effective way. So I'm going to highlight three major questions surrounding U.S. disability policy, and in answering them, I will both provide the larger context of disability research, as well as highlight some of my own research related to these questions. So I just want to start with some background on Social Security disability programs. Many of you are familiar with the Social Security disability programs, but just to make sure that we're all on the same page, just wanted to provide one slide of brief background. So there are two major federal disability programs in the United States. The first is the Social Security Disability Insurance Program, which enrolls about 9.5 million adults. The SSDI program requires a work history, and your monthly benefit is based on your past earnings. And it comes with Medicare eligibility after a 2-year waiting period for most beneficiaries. In contrast, the Supplemental Security Income Program is a cash welfare program. It includes about 5 million adults and more than 1 million children who receive benefits. SSI requires low income and assets, and the benefit amount is based on current income. And SSI in most states comes with automatic Medicaid eligibility. Now, the way the disability determination process works, and this will be relevant for some of the details of the research that I present, is that applicants have to be out of work for at least 5 months prior to receiving benefits. The initial disability decision is made by a disability examiner at a state disability determination services office, and applicants who are rejected can appeal their decision to the administrative law judge level and then to higher levels like the appeals council. So a lot of the discussion about the SSDI and SSI programs has focused on their expansion in recent decades. You can see from this graph that both of these programs have experienced substantial expansions in recent decades. Some of the most notable events have been the 1984 legislation that expanded medical eligibility criteria for adults. And then in 1990, there was a Supreme Court decision that also expanded medical eligibility criteria for SSI children and resulted in an expansion of the SSI Children's Program to include children with behavioral conditions and mental conditions other than intellectual disability. Now, you can see that in the past few years, both SSDI and SSI enrollment have not only plateaued but seem to be decreasing. There's a lot of speculation about why this enrollment has decreased in recent years, and I would say that researchers don't yet have a definitive answer to that question of why we're seeing these decreases in enrollment, but it's a very active area of research. I just wanted to highlight some current policy proposals surrounding disability programs. So the President's FY19 budget includes several reform proposals. For example, it proposes to reduce retroactive benefits to disabled workers from 12 months to 6 months, to reduce SSI benefits for families who have more than one recipient, and one of its stated goals is to increase the labor force participation of disability recipients. And there are many initiatives surrounding the reform of the both disability programs. So today I want to focus on three major questions surrounding disability policy in the United States. These are three questions that I think are critical to designing disability programs effectively. The first is, what are the economic costs and benefits of disability programs? So like all social insurance or social safety net programs, disability programs have both costs and benefits. On the one hand, these programs have benefits in terms of consumption, well-being, health, that they can improve these consumption, well-being, and health for recipients. On the other hand, we also need to be aware about any potential perverse incentives or discouragement of achievement that disability programs could create. And this is ultimately an empirical question. So we can derive from theory that, for example, potential perverse incentives exist or that benefits for consumption exist, but it is really when we go to the data that we're able to quantify empirically the magnitude of those parameters, and that's critical for designing programs optimally. The second question that I want to talk about today is whether disability programs are going to the right people. And obviously, the definition of right people might vary from person to person, right? So who is quote unquote deserving of disability benefits, that might be something that varies based on individual preferences. But I want to try to present a framework for thinking about this question systematically so that no matter what your preferences are for whom you think should be receiving disability benefits, we can think about how to design disability programs in a way that better serves people that we think are deserving of these benefits, and then also make sure that the program is financially secure and doesn't encourage people who you might think are less deserving from using the benefits. So finally, the third question that I want to talk about is how disability policy can improve the outcomes of children receiving disability benefits. As I mentioned a couple of slides ago when we saw that figure of increasing enrollment in disability programs, the SSI Children's Program has also been increasing in enrollment, and there's been very little research so far on the effect of disability programs on the long-term outcomes of children. And so I'm going to share some of my research on that topic and the policy implications and thinking about how we can better serve children who receive SSI benefits. Okay, great. So I'm very excited to get started with the first question of what are the costs and benefits of disability programs? So as I mentioned, the potential costs and benefits of disability programs are similar to other social insurance or social safety net programs. When we think about the economic costs of disability programs, we don't mean just the amount of money that taxpayers are paying into the disability program. We also mean, does this program distort incentives in any way? So a common criticism of disability programs or welfare programs more generally is that they might discourage achievement, or they might create perverse incentives and maybe reduce educational achievement or discourage work. And the kind of theoretical reasoning behind that argument is that disability programs are conditioned on not working. So either, for example, in the SSDI program, there is a substantial gainful activity level above which beneficiaries are not allowed to work if they want to continue receiving benefits. For SSI, this kind of discouragement takes the form of a 50% phase out of benefits. So for every dollar that an SSI recipient earns, benefits are reduced by 50 cents. And so these kinds of rules, sort of conditioning the benefits on not working, we think might discourage people from working when they otherwise would have. And we have actually one of the few areas, I would say, of disability policy where we have a consensus in the research literature that disability benefits reduce work moderately among disability recipients. So a number of papers have found approximately, give or take 10 percentage points or so, a 30 percentage point reduction in labor force participation. So there's been a substantial amount of research that has tried to look at what is the effect of disability, what is the causal effect of disability benefits on labor force participation. And so we can think of this 30 percentage point reduction as kind of an upper bound for how much disability programs might discourage work. Okay, and that's one way that we can think about the economic costs of disability programs. But of course, there is the other side of the equation. There is, what are the benefits that disability programs provide? And there has been much less research on this question, right? To be able to think about the optimal design or the optimal generosity of disability programs, we have to know the magnitude of both the costs and the benefits. But the research has really focused mostly on the costs of these programs in the form of discouraging labor supply. And while that is important, we also have to know what are the benefits of these programs. And I think the reason that research on the benefits of these programs has been so limited is data constraints. So to study labor market effects or earnings effects, we can use administrative earnings data, basically W-2 and tax data, to study that question. But if we want to study a question like what is the effect of disability programs on consumption or well-being or health, those are outcomes that we don't collect administrative data on. And so it's much more difficult to be able to estimate the effect of disability programs on those positive outcomes, even though knowing the effects on the positive outcomes is just as important as knowing the effects on the negative outcomes. So in a recent paper with my colleagues Paul Gross and Young Su, we try to overcome this data constraint by linking the universe of Social Security disability records to nationwide financial records on foreclosures, evictions, bankruptcies, and home purchases and sales. And we find in this paper that disability programs reduce the financial distress of disability recipients substantially. So what we find in this paper is large reductions in foreclosures, bankruptcies, and home sales when people receive disability benefits. So let me just talk in a little bit more detail about that paper. And the question that we're going to be interested in this paper is, what is the effect of disability programs on financial distress? And to answer this question, we use an age-based discontinuity in disability eligibility standards. And I'll talk a little bit more about that in a second. And as I mentioned, to overcome this data constraint, we're going to link the Social Security Administration records, disability records, to financial records on several financial outcomes. So we have nationwide records on bankruptcies, foreclosures, evictions, and home transactions. that we are merging to Social Security disability records at the individual level. So this was a massive data collection and merging process, and it's going to allow us to look at the causal effect of the disability program. And to explain in more detail the way that we're going to estimate this causal effect, the way that we're going to do this is by using a particular age-based rule in the disability determination process. So what you're seeing on your screen right now is the different stages of the disability determination process. So when someone applies for a disability program, their case is assigned to a disability examiner. And that examiner is first going to consider whether this person is engaging in substantial gainful activity. Are they working above the SGA level? If the answer is yes, that applicant's immediately going to be denied. If not, the examiner moves to stage 2 and asks, does this applicant have a severe impairment? If the answer is no, the applicant is denied. If the answer is yes, they move to stage 3, where the examiner asks, is the applicant's medical condition on the official listings of qualifying medical conditions? If the answer is yes, that applicant's going to be allowed. If the answer is no, they're going to move to stage 4, in which the examiner asks, does this applicant have a capacity for past work, for the previous work that they've done? If the answer is yes, the applicant will be denied. If the answer is no, they move to stage 5. Now, stage 5 is the stage in which the examiner is going to consider what we call vocational factors: age, education, and previous work experience. And you should think of the applicants who make it to stage 5 as not the least severe, because the least severe would have been denied in stages 1 or 2. Also, probably not the most severe, because they probably would have been allowed in stage 3, but applicants who are somewhere in the middle. And we're going to use the rules associated with stage 5 to estimate the causal effect of disability benefits. The way that we're going to do this is by using this age-based discontinuity. So what you're seeing on your screen now is the initial allowance rate by the applicant's age at the initial decision date. And what you can see is that at age 50, the likelihood that the examiner allows the applicant jumps right at the age 50 cutoff. And similarly, at age 55, the likelihood that the examiner allows the disability applicant is jumping right at that age 55 cutoff. And the reason that you see this pattern is that the standard for disability benefits becomes slightly more lenient at age 50 and at age 55. So right above these cutoffs, the disability examiners are required to use more lenient standards for disability applicants. So basically, an applicant who applies just above age 50 or just above age 55, the examiner has to use more lenient standards than for applicants that are applying just below age 50 or just below age 55. And that's what's creating these discontinuities. And this is the variation that we're going to use to look at what is the causal effect of being allowed onto a disability program. And the basic idea is that, let's look at the age 55 cutoff, that the applicants who are just to the left of this age cutoff are exactly the same as the applicants who are just to the right of the cutoff. The only difference is that because those who are just to the right of the cutoff are slightly older, they're going to be more likely to be allowed. And so the only difference between the applicants just to the left and just to the right of the cutoff is that the applicants just to the right of the cutoff are going to be allowed onto disability programs. And then what we're going to do is we're going to look a few years later at their rates of foreclosure, bankruptcy, and home sales and home purchases. And we are going to be able to see in the graph the causal effect of being allowed onto a disability program. Okay. So let me show you that evidence now. So what you can see here is the likelihood of experiencing a foreclosure within 3 years after the disability decision. And remember from the previous picture that the applicants on the left-hand side here, because they were just under the age cutoff, the applicants on the left-hand side are going to be less likely to be allowed onto the disability program. The applicants on the right-hand side are going to be more likely to be allowed onto the disability program. And what you can see from the graph is that the applicants on the right-hand side of the graph, the ones who are more likely to be allowed onto the disability program, have lower foreclosure rates in the 3 years after the initial disability decision. We can see a similar pattern with respect to home sales. So with home sales, we see something similar where the applicants just to the right of the cutoff have net home sale rates than applicants just to the left of the cutoff. Okay, so this is again an indication that applicants just to the right of the cutoff, the ones who are more likely to be allowed onto disability program, are less likely to sell their home in the 3 years after the disability decision. We see a similar pattern with respect to bankruptcies. So again, what you can see in this graph is that the applicants just to the left of the cutoff who are less likely to be allowed have higher bankruptcy rates 3 years after the disability decision relative to applicants just to the right of the cutoff. But again, it's the same strategy that we're using. We're going to compare bankruptcy rates on the right-hand side of the cutoff to the left-hand side of the cutoff, and we see that bankruptcy rates on the right-hand side of the cutoff are lower than bankruptcy rates on the left-hand side of the cutoff. And so that's suggesting that being allowed onto a disability program does in fact reduce the likelihood of experiencing bankruptcy. And then finally, we can look at home purchases. So this graph is a little bit less clear, but in the actual estimation, what we find is that applicants just to the right of the cutoff are more likely to purchase a home than applicants just to the left of the cutoff in the year after the disability decision. Okay, so this one goes in the opposite directions relative to the other outcomes. Remember, we saw decreases in foreclosure and bankruptcy and home sale. We're going to find an increase in home purchases when people are allowed onto disability programs. Okay, so just to summarize what we find in this paper, again, the question that we're asking here is, what is the causal effect of disability programs on the financial distress of recipients? And what we find is that within 3 years of the initial disability decision, being allowed onto a disability program reduces the likelihood of foreclosure by 30%, reduces the likelihood of filing for bankruptcy by reduces likelihood of foreclosure by 30%, the likelihood of filing for bankruptcy by 40%, and the likelihood of a net home sale by 25%. Just to clarify what I mean when I say net home sale, I mean a sale that is not immediately followed or preceded by a home purchase. So what we're trying to get at there is we don't want to just pick up people who are moving. We want to pick up people who might be selling their homes in distress. So these are home sales that are not associated with a move. It's just a sale, and then they might go on to rent or live with family or something like that. And then within the year after the initial disability decision, we find that disability allowance is increasing the likelihood of home purchases by 20%. So what we find in this paper basically is evidence of the benefit side of that trade-off between the costs and benefits of disability programs. So previous research has really focused only on the cost of these programs. This is one of the first papers to also study the benefits of disability programs, and we find that these programs have cause large reductions in financial distress. Okay, great. So now I want to talk about the second program, whether disability benefits are going to the right people. And again, this question is posed in a somewhat provocative phrasing, right? Obviously, we might disagree about who the right people are to be receiving disability benefits. What I want to talk about in this section is whatever your preferences might be for who should be on a disability program, how can we determine if those people are in fact receiving disability benefits, and the people that you would consider to not be deserving of disability benefits are not receiving benefits. So the two main margins for determining who gets disability benefits, obviously, the first one is the disability determination process. There are disability examiners, administrative law judges, other adjudicators who are making decisions about which applicants qualify for a disability program. So this is the main screening mechanism that we think of when we think of who receives disability benefits. And in this mechanism, 42% of applicants are allowed at the initial level and 16% of applicants are allowed on appeal. A second mechanism, one that we might think less about in terms of who is encouraged or discouraged from receiving disability benefits, is the application process itself. So obviously, in order to get to the disability determination process, you have to first apply for a disability program. Applying for disability programs is a non-trivial feat. It requires a substantial amount of paperwork. It requires medical documentation. It might require following up multiple times with the SSA worker who is preparing your application. And so, there are several costs associated with the process, the application itself. There's also the opportunity cost of the time that you spend out of the labor market, right? So we remember from the beginning that you have to be out of the labor market for at least 5 months. That is a cost, right? We're requiring that people not be working if they apply for a disability program. And what I do in my paper, my recent paper with Yue Li, is I look at the effect of increasing the cost of applying for disability programs on how many people apply for disability programs and the type of people who are discouraged from applying for disability programs. And what we find in this paper is that when you increase the difficulty of applying for a disability program, you end up discouraging applicants who have fairly severe medical conditions and also applicants who have low education levels. Okay, so let me talk in a little bit more detail about that paper. Again, the question we're interested in here is who is discouraged from applying for disability when we make it more difficult to apply for the disability program? And the way we're going to answer this question is by using the closings of Social Security field offices. So Social Security field offices provide assistance to applicants with completing the application. And basically what we're going to do is we're going to look at neighborhoods around in areas where a Social Security field office is closed, and we're going to look at how much the number of disability applications falls, and also what types of applicants are being discouraged from applying. And similar to the previous paper, we're going to use detailed administrative data on Social Security administrative data on applicant characteristics and also field office location and characteristics to answer this question. So this map, which I apologize is showing up quite fuzzy, but hopefully you can see those red diamonds in the map. The red diamonds indicate closed Social Security field offices. So those are offices that have closed in the last 2 decades. The blue stars, which are a little bit harder to make out, but you can see that there are many more blue stars than there are red dots. The blue stars are field offices that are still open. And what we're going to do in this paper is we're basically going to look in the areas around the closed offices to see how the number of disability applicants changes and how the number of disability recipients changes. Okay. So this figure is showing you the timing of those Social Security field offices. So we saw from the map that there were about 120 field office closings in recent decades, and this figure is showing you when they closed. So you can see that there's been a large concentration of closings in the last few years since 2010. And what we're going to do in this paper is we're going to look first at what's happening to the number of disability applications in the neighborhoods surrounding the closed field offices. And what we find is that there is a large decrease in the number of disability applications when your local Social Security field office closes. So when the local Social Security field office closes, disability applications in that area are going to fall by 10%. Okay, so you can see that this is a pretty large decrease, 10% of applications. And the other thing you can see from the graph is that this is a pretty persistent effect. So even 2 years after, the date of the field office closing, applications show no sign of recovering. Okay, so this is a pretty large and persistent decline in the number of disability applications resulting from the closing of the field office. So that's telling us how many people are discouraged from applying. What we also want to know is what types of people are discouraged from applying. Is it just applicants who would have been rejected anyway? Or is it actually applicants who would have been allowed onto the program if they had applied? If we were just discouraging applicants who would have been rejected anyway, then these closings could potentially be a good thing in the sense that, you know, we don't waste the applicants' time, the applicants who are going to be rejected anyway. We also don't spend taxpayer money reviewing applications that are going to be rejected anyway, right? So it's possible that this closing is just going to discourage applicants who would be rejected anyway. But that's actually not what we find. What we find is that there are also large decreases in the number of disability recipients. So there's about a 16% decline in the number of disability recipients resulting from a Social Security field office closing. And the reason this comparison is important is what it's telling us is that it's not just that the applicants who would have been rejected who are being discouraged from applying. It's actually applicants who would have been allowed onto the program if they had applied. And the way that we know that is that there is a large decline in the number of disability recipients. So we're discouraging people who would have become disability recipients from applying for the program. Basically, the field office closes, it's now harder to apply for the program, and so we end up discouraging, you know, both people who would have been rejected and disproportionately people who would have been allowed onto the program had they applied. So that's one of the main results of this paper. We can also look more closely at the characteristics of the applicants who are being discouraged from applying. So this graph is showing us the drop in the number of applicants by the severity of the applicant's condition. And you can see from this graph, so what I've done in this graph is that the lightest color here is lowest severity individual. Let me just point that out to you. So this is the lowest severity individuals in the lightest line. These are medium severity individuals. These are high severity individuals. And these are very high severity individuals. Okay. And what you can see, so this is a somewhat nuanced finding, right? I like to say that this is a Rorschach test for how you think field office closing should play out, because you can look at this graph and you can say, okay, well the very high severity applicants, they are continuing to apply, right? That's what we see. We see basically that the very high severity applicants, they continue to apply. But you can also look at this graph and you can say, well, the low severity applicants, the applicants who are going to be rejected, they're also, for the most part, continuing to apply. The people who are the most discouraged are the people in the middle of the severity distribution, these medium severity and high severity individuals. Both the medium and the high severity individuals are applicants who would have been allowed onto the program had they applied. Okay, and we're seeing the biggest effects for those severity categories. We can also look at these results by socioeconomic status and particular education levels. And what we find here is that we see the largest discouragement effects for applicants who have less than a high school education. You can see that applicants who have a college degree, their applications do decline somewhat by about 5%, But for the most part, it seems like the college graduates are figuring out how to navigate the system despite the field office having closed. So we don't know exactly what they're doing. Some of them are substituting to the online application. Some of them might be going to another field office. Some of them might be just figuring it out on their own. But they are not very discouraged from applying. The people who are the most discouraged from applying are the people with the lowest levels of education. So you can see that for those with less than a high school degree, there's a 14% decline in applications, and for those with a high school degree but no college, there's about a 7% decline in applications. Okay, so just to summarize this paper, what we're trying to do in this paper is look at when we make it harder to apply for disability programs, who ends up being discouraged, who is screened out as a result. And what we find is that field office closings, which is our way which is our kind of measure of making it harder to apply, making it more costly to apply for a disability program. We find that this reduces applications by 10% and disability allowances by 16%. We find that these effects are very persistent. They persist for at least 2 years after the field office closing, and they're disproportionately affecting applicants with low and medium severity conditions and applicants with lower socioeconomic status. Okay. So finally, the last question that I want to talk about is how disability policy can improve the outcomes of children receiving disability benefits. So as I mentioned at the beginning, supplemental security income provides benefits and Medicaid to not only adults with disabilities, but also to children with disabilities, more than 1 million children in the United States who have a disability and whose families have low incomes and assets. And these children have poor life outcomes. So SSI adolescents with mental and behavioral conditions, from previous literature, we know that they have dropout rates of around 45%. They have arrest rates of around 30%. So these children are very disadvantaged. And what I look at in a recent paper is what is the effect of removing children from SSI at the age of 18. So when children turn 18, the definition of disability changes from the child definition in terms of age-appropriate activities to the adult definition in terms of work. So in adulthood, disability is defined as an inability to earn substantial gain, to do substantial gainful activity. So what I want to know in this paper is when children who receive SSI benefits are removed from the program or removed from SSI, what happens to them in the labor market? So one side of the political debate might say that, well, you take these kids off of disability programs and they do well in the labor market, essentially, that they have the ability to earn at self-sufficiency levels, and so once you remove them from a disability program, they're going to do fine in the labor market. The other side of the debate might say that, well, these children really continue to need benefits in adulthood, and so once you take them off the program, they're going to do poorly in the labor market. And what I find in this paper is that when we take SSI children off of SSI at age 18, they, in fact, appear to do pretty poorly in the labor market. So they earn on average just $4,000 a year, and their total income is going to fall substantially because even if they earn a little bit more, it's not enough to replace the lost SSI income. So let me talk about that paper in more detail. So again, what I want to know in this paper is what is the effect of removing children who receive SSI benefits from SSI when they turn 18? What is the effect on their adult earnings and adult income? And the way I'm going to answer this question is by using a birth date discontinuity that was created by the 1996 Welfare Reform Law. And I'll talk about that in a second. And again, I'm going to use detailed Social Security administrative data to track the earnings and income of these children into adulthood. So the basic empirical method here is what you see on your screen, which is that as part of the 1996 Welfare Reform Law, SSI children who are receiving SSI benefits who had an 18th birthday just after the date of welfare reform enactment, which was August 22nd, 1996, nearly all of those children received an age 18 medical review. And the age 18 medical review means that the child is reevaluated based on adult disability criteria. So you can see from the graph that nearly all of the kids to the right of the cutoff are receiving this medical review, whereas very few of the kids to the left of the cutoff receive the medical review. What that means is that many of the kids to the right of the cutoff are going to be removed from SSI as an adult because they didn't pass this medical review, whereas most of the kids to the left of the cutoff, they're going to be grandfathered onto the adult program. So they're going to remain on the disability program. And so this is, again, what's going to give us our variation. The kids to the left and the right of this cutoff are basically the same. So there was an arbitrary date, August 22nd, 1996, on which welfare reform legislation was passed. And the rule was that if you had an 18th birthday just after that date, you were going to get a medical review, and you could therefore be taken off of, we can be removed from the SSI program. So the kids on the right-hand side who just happen to be just after this cutoff, they're going to get a medical review, are more likely to be taken off the program. We're going to be able to compare them to the kids just to the left of the cutoff who are going to stay on SSI as adults, and we'll be able to compare their outcomes in adulthood. Okay. So the first thing here is just to verify, in fact, that the kids to the right of the cutoff, remember these are the kids who are more likely to get the medical review, are less likely to be receiving SSI benefits 4 years later than kids to the left of the cutoff. Okay, so this is just verifying that, in fact, these medical reviews did what we think they would do, which is that the kids who were more likely to get the medical review were also less likely to be receiving SSI in adulthood. Okay. And so now we can look at their earnings in adulthood. And what we see from this graph is that the kids to the right of the cutoff, the kids who are more likely to get the medical review and therefore more likely to be removed from SSI, their earnings are slightly higher in adulthood than the kids to the left of the cutoff. This is, in fact, what economic theory would predict. Economic theory would predict that when you take away income, when you take away SSI income from people, right, they're going to find other ways to make up that income, and one of the ways they're going to do that is by working more. And so we see, in fact, that the kids to the right of the cutoff are working a little bit more than the kids to the left of the cutoff. Okay. Now, what we really care about, though, is their earnings levels and their income levels. And so what this graph is showing us, so in this graph what I'm doing is I'm plotting by the child's age, so from age 15 to age 33, the average annual earnings of each group. So the gray series here, the gray series is the average earnings of the group on the left-hand side of that cutoff, the group that was grandfathered onto the SSI program. They stayed on SSI into adulthood. Okay, so they have, as you can see, very low earnings. And then we can look at the earnings of the group to basically the right-hand side of the cutoff, the SSI children who were actually removed from SSI because they got this medical review. And what you can see is that they do, in fact, as I mentioned in the previous slide, they do, in fact, earn more than the kids to the left of the cutoff. So when we take them off of SSI, they do earn more in the labor market. Okay, so this is all labor market earnings. But you can notice two things. One is that their earnings levels are very low, about $4,000 a year. The other is that their earnings trajectory is very flat. You would be hard-pressed to find another group in society whose earnings trajectory is this flat. And it's useful to put these results in context by comparing these kids who were removed from SSI to other disadvantaged children. So the light green series here is children who applied for SSI as children but were denied because they because they did not meet medical eligibility criteria. Okay, so these are kids who are deemed to be too healthy to qualify for SSI. This other group in the dark green is youth whose families received AFDC when they were young. And so these two green groups, you should think of them as children who are disadvantaged but not necessarily disabled. And what we find for those disadvantaged but not disabled groups is that their earnings are, while still low, somewhat higher, and also their earnings trajectory is substantially more robust than the earnings trajectory of youth who are removed from the SSI program. Okay, so we find that when these kids are removed from SSI, even up to age 33, they're earning very little on average in the labor market. So just to summarize the findings from this paper, the question that I'm interested in this paper is, what is the effect of removing low-income youth from SSI at age 18 on their adult outcomes? And what I find can be summarized in this graph. So the first thing is that the kids who are removed from SSI at age 18, they're losing a substantial amount of SSI income. They're losing almost $8,000 a year in SSI income because they're removed from the SSI program. They make up about a third of that in earned income. So they go out into the labor market and they earn more than their counterparts who stayed on the SSI program. Okay, but you can see clearly not nearly enough to make up the SSI income that they lost. And then they also are going to lose some additional amount in other transfer income. This is mostly Social Security disability insurance. So they were removed from SSI. They're less likely to apply for SSDI, and so they also lose some income because they're not receiving SSDI benefits. When we put all of those together, we get a total observed income of about 80% of the original SSI loss. So this is, in present discounted value terms, about a loss of about $73,000 in observed income over the next 16 years. So when these kids are removed from SSI, even though they do earn a little bit more, right, their total income falls substantially because the increased earnings is not nearly enough to make up the SSI income that they lose. And so the result of removing kids from SSI appears to be a large drop in total income. Okay, so just to wrap up, the three questions that I wanted to talk about today were, first, what are the economic costs and benefits of disability programs? So I walked through the literature showing that there's some costs in terms of discouraging labor supply, but I also presented some of the first evidence on the benefits of these programs in terms of reducing financial distress. Regarding the second question about whether disability benefits are going to the right people, we find that when we design disability programs to be more difficult to apply to, that it seems to be discouraging people that we currently consider deserving of disability benefits. And then finally, about how disability policy can improve the outcomes of children receiving disability benefits. The current policy of removing kids at age 18 seems to result in substantial income losses. So even though kids who were removed from SSI, they do earn a little bit more than kids who are not removed from SSI, their total income falls substantially. And I really appreciate your attention. I'm looking forward to questions. The last thing I'll say is I would be very interested in working with any of you who have a social program that your agency administers or that you're otherwise associated with, that you're looking to evaluate. It doesn't have to be a disability program, but if you're interested in some of the work that you saw today and you think that some of these tools we might be able to apply to a program that you work with, please get in touch and I would love to talk to you more. So I'm going to hand it back to Dave and look forward to your questions.
Okay, thank you so much, Manasi. That was super informative, and I just appreciate all the detail that you went into there. So I just want to remind our audience that you can type questions into the Q&A box at the bottom of your screen. We have about 10 minutes left, so we'll get to as many of those as we can next little bit here. So, Manasi, our first question today, we have a question from CT about specifically about increased lifespans for children and adolescents, especially those with sort of severe disabilities, and areas we might be concerned about for those individuals given some of the proposed changes in eligibility and benefits. Do we know anything about that? Is there anything we should be thinking about there?
Yeah, so this is a very good question. The policy that I was studying in this paper, right, the children with very severe, extremely severe medical conditions, children with intellectual disabilities, for example, they are unlikely to be removed from SSI at 18. So all kids are required to get an age 18 redetermination, a medical review, but the kids who have the most severe medical conditions, they will generally stay on SSI in adulthood. And so the population that we are thinking about when we think about who is this age 18 redetermination affecting is a lot of kids, for example, with mental and behavioral conditions, a lot of kids whose disability is less likely to qualify them once the definition of disability changes to an inability to work. And one of the big questions in creating this policy is what is the right age, for example, at which to evaluate a child. That if a child, especially a child with disability, is still developing at the age of 18, is the age of 18 the right age at which to evaluate them? So many children continue in the public school system into their early 20s, and part of the reason is that they might take some more time to learn, and we think that they should continue to receive public education services to a later date. So certainly one thing that we should think about, and this is sort of related to the lifespan question, is what is the right age at which to do this kind of reevaluation? And of course, the second question is, should we be reconsidering how we define disability in adulthood? And another thing that I'll say is that it's not completely clear from the results why kids are doing so poorly when we take them off at 18. Is it a result of the disability, or is it a result of poverty and low human capital? So SSI is a very well-targeted program. SSI recipients are very low income, quite disadvantaged. And so, part of the reason for that graph where I was comparing SSI kids to other disadvantaged kids was to think about, is this just a common outcome for other disadvantaged kids? And it appears that children receiving SSI benefits are in fact a special group, that they're doing particularly poorly in the labor market relative to other disadvantaged children. And so I think these results, in response, we want to think about both the age at which children are being reevaluated and also which conditions are qualifying them for adult SSI, and also third, whether there are other supports that these kids need, maybe because of their disability, but also more generally because of poverty and low human capital and the circumstances in which they're growing up.
Okay, thank you. We have a question from Carol, a few actually, but I'll try to summarize it. But kind of about how we should be thinking about these programs in terms of their broader fiscal impact. These are big, expensive programs, and I know there have been a handful of articles over the last few years kind of raising concerns about either non-work or growing numbers of people involved in these programs. What do you tell people when you probably get these questions a lot? How should we be looking at this?
Yeah. So there's been quite a bit of work on the effect of these programs on the federal budget, and these programs certainly have been growing. They're not growing as rapidly anymore, and part of that is probably the aging of the population. More of the elderly are going on to retirement programs. I think I take a slightly different perspective on this question than the common debate, which is that I think the real question we want to ask is, are the people who are receiving disability benefits, do we think that they're deserving of government benefits in some way? So I think the debate over these programs has focused kind of narrowly on whether these recipients have a disability of the particular type that is specified as qualifying for the program. But the other thing we have to think about is the broader social safety net program, right? And it could be that there are people who are in need of government benefits, perhaps that we would consider deserving of government benefits, who are experiencing distress for reasons other than disability. And it could be that in the absence of those other programs, that people are turning to disability programs for assistance. Disability programs may not be the ideal way to help those people who are in distress, but in the absence of other programs, disability programs might be serving people who may not have the severity of the disability that we think should qualify someone for this kind of program, but might be deserving in other ways, might have experienced a job loss or some other kind of shock. And so when we think about the expansion in disability programs and how much we're spending on disability programs, I think we do have to step back and think about, are disability programs serving a role that we think that other programs, other social safety net programs should serve? So if we created a separate social safety net program that was targeted more toward people who were experiencing non-disability related distress or more temporary distress, that would also take up some amount of the federal budget. And if disability programs are essentially serving that role right now in the absence of those other programs, we want to think about not just, how much are disability programs expanding, but how many people are they serving, and are they kind of serving as a substitute for a broader social safety net system?
Okay. And kind of similar to that question, I think there's been a lot of talk about work requirements in other programs, and how should we be thinking about sort of the interactions there between those programs? If we have some programs that are sort of predicated on work, and whereas this one very much isn't, what's sort of the gap there?
Yeah, that's a great question, and it's a question that we don't have very much evidence on. There's not a lot of evidence on how work requirements affect enrollment in disability or non-disability programs. But the paper that I presented on field office closings, we can think of field office closings generally as an example of a way in which we make it harder to apply for a program. You can think of work requirements similarly, that the work requirements, both because they actually require work and also because they require documentation, checking in, submitting documentation that you've been working. That is a type of increase in application costs or increase in enrollment costs that makes it more difficult to be enrolled in a program. And so it could be the case that as other programs have work requirements implemented, the size of those programs might decrease because it's, again, more costly to apply for those programs or be enrolled in those programs. And it could be that people substitute toward disability programs. And that's a question that we don't know empirically the answer to. I suspect if the work requirements continue in other programs for some years, that we'll be able to answer this question of whether more people are substituting to a disability program. And then we have to think about the implications of that, right? Because generally, disability recipients don't leave the disability program until they retire. And so if we're sort of transferring people from a temporary program like food stamps or TANF to the disability program by implementing work requirements for food stamps or TANF, then it's not clear, what the overall either fiscal impact is or what the overall effect on recipient well-being is.
Okay. So we are just about out of time, and I want to put your information back up there for people that are interested. But in the last little bit that we have here, I'm wondering if you can give us kind of a wrap-up thought. You know, either areas that you want to see more research in, that you're curious about, you know, how things are changing, or just kind of what we should be thinking about as we think about these programs. Do you have something that you want to talk about?
Yeah, absolutely. I'd say a couple of things. So the first is, you know, what I mentioned at the beginning, which is that we have a lot of evidence on the labor supply effects of disability programs, but not very much evidence on the benefits of these programs. And it's obviously it's important that we not ignore, that researchers not ignore the benefits of these programs, because there's a reason that we have these programs, right? Which is that we think that there are some people who should not be working, for whom working is very difficult because of their medical condition. And it's important to understand what are the benefits of the programs in terms of consumption, well-being, health for those individuals. And then more broadly, what are the benefits of the program for recipients? So this gets back to the point that I was just making about, you know, are disability programs serving a broader population? So are they serving a population that may not have a qualifying disability in the narrow sense of that term, but that we think are more deserving, or rather are deserving of some kind of government assistance? And is there a way to design the social safety net program such that those individuals who are in need of temporary assistance, you know, that it's easier for them to qualify for some kind of temporary government assistance, so that it's not just that we provide benefits to someone who promises never to work again, but rather that we're providing the right benefits to the right people, so that people who are in need of some kind of temporary assistance have assistance available to them through some other mechanism than the disability program. And, you know, thinking about how that would promote the integrity of the disability program itself, as well as helping individuals who are in need of assistance, who are currently turning to the disability program, but may not need a lifetime of disability benefits to get back on their feet. So I think that's the kind of the big challenge facing disability programs is, what is their purpose, and is there a way to change the other parts of the social safety net to make the disability programs more sustainable and improve their integrity?
Okay. Manasi, thank you so much. I'm really grateful for your presentation today. I think you gave us a lot to kind of look at here.